No, go ahead. Okay, go ahead.
Okay, my presentation is on the Joint Commission, and it's by Karen Christensen. So here are a few facts about the Joint Commission. First of all, it was formerly known as Joint Commission on Accreditation of Healthcare Organization, and then the name was shortened, which is much better. They are an independent nonprofit organization. The Joint Commission is considered the gold standard of accreditation for healthcare facilities, and they accredit nearly 21,000 healthcare organizations in America, so a lot. They are recognized for their high standards and their level of quality of performance. Just wanted to show also the mission and vision statement so you can kind of understand a little bit more about them. The mission is to continuously improve healthcare for the public in collaboration with other stakeholders by evaluating healthcare organizations and inspiring them to excel in providing safe and effective care of the highest quality and value. The vision statement is all people always experience the safest, highest quality, best value healthcare across all settings. And so just as you can see, their mission is to provide the best care for patients and make sure that hospitals and other facilities meet those high level standards. So what is accreditation? Just kind of a definition from the dictionary. Accreditation is the action or process of officially recognizing someone as having a particular status or being qualified to perform a particular activity. So in this case, when we are talking about the Joint Commission, accreditation is voluntary. It's a voluntary procedure that hospitals and other facilities seek out in order to gain status in the community and organizational approval. To be accredited by a high standard organization such as the Joint Commission gives the healthcare facilities recognition and guarantees to the consumer that they're reputable. And so it's a big deal, and it's important for healthcare facilities to be accredited by someone that has a good reputation. Why does accreditation matter? Just number one big reason is that accreditation builds confidence. When you're a patient and you're choosing a healthcare facility, of course you want to know that you're receiving the best healthcare and that the hospital has really high standards, quality processes, and reputable service. And there is a huge list of benefits for accreditation. I didn't list them all, and I still listed a lot, so I'll just go through a few of them, and as we go through this presentation, we'll talk about them. But some of the benefits are that it helps organize and strengthen patient safety efforts, helps to strengthen community confidence in quality and safety of care, treatment, and services, provides a competitive edge in the marketplace if you're accredited, helps you to be more competitive, improves your risk management and risk reduction, may reduce your liability insurance costs, provides education to improve business operations, which is important, provides professional advice and counsel, enhancing staff education, and a customized intensive review. It helps enhance your staff recruitment and development, and provides deeming authority for Medicare certification, which is something that we'll talk about more. Is recognized by insurers and other third parties, provides a framework for organizational structure and management, may fulfill regulatory requirements in select states, provides practical tools to strengthen or maintain performance excellence, and aligns healthcare organizations with one of the most respected names in healthcare. So when was it founded, by who, and for what purpose? The Joint Commission was founded in 1951. The reason was to improve healthcare for the public by holding facilities to a high standard through evaluations and on-site surveys. And it was founded by Ernest Codman, who was an MD. He had been an advocate of hospital reform and is acknowledged founder of what today is known as outcomes management in patient care. Codman was the first American doctor to follow the progress of patients through their recoveries in a systematic manner. With an interest in healthcare quality, Dr. Codman also helped lead the founding of the American College of Surgeons and its hospital standardization program. This program eventually became the Joint Commission on Accreditation of Healthcare Organizations, and his ideas were revolutionary for the time period and obviously made a really big impact as they've continued today. What is the significance of the word joint? Again, another definition. Joint means the place at which two things or separate parts of one thing are joined or united. So in this case, the Joint Commission was a product of a combined effort by the American Hospital Association and the American College of Surgeons, hence the use of the term joint as those two combined. What kind of organizations are eligible for joint accreditation? Hospitals, long-term care facilities, ambulatory surgery centers, or other non-hospital provider organizations. So who are the competitors and how are they different from their competitors? I've got a lot going on here. On this slide, I just listed two of the major competitors to the Commission. Number one is the Healthcare Facilities Accreditation Program, which is HFAP. And number two, Det Norske Veritas Healthcare Organization, which is DNV. So just a little bit about each of these organizations. The HFAP is a nationally recognized accreditation organization with deeming authority from CMS.
Hey, Karen, can you hear me? It looks like you're on mute if you can hear me.
Okay, yep.
There you go. Yeah, it looks like you dropped off there.
Shoot, how far did we get? Was I almost done?
Yeah, I'm pretty sure you were pretty far. And do you want to bring up the slides
Yeah,
again?
you bet.
Okay. Let's see. So go down a little bit.
Okay,
Just trying to
we could
think.
get to,
Yep, you were through there.
okay.
Yep, you were through there. Yep, you were past that one.
Okay.
Yep, you were past that one.
Oh, that's good. Deemed status and percentage of hospitals accredited.
Why don't we just start on this one again,
Okay,
and then just go from there? And then
okay.
I'll just tell the students in the thing to just skip ahead till they see this part again.
Okay, shoot.
No, not a problem. We're still recording right now, so just go ahead and continue on.
Okay, sounds good. All right, so what percentage of all acute care hospitals are Joint Commission accredited? That's approximately 80% of the nation's hospitals. The next one, what is the meaning of the term deemed status? This is a really important one and one that you'll want to remember. Who gives it and to whom is it given? Healthcare organizations that want to receive payment from Medicaid and Medicare must be certified as complying with the standards or the COP, which is conditions of participants of the federal government. Every healthcare facility must meet these COPs. The certification to receive the payment for those government programs comes from a survey that is conducted by the CMS. So a deemed status means that the healthcare facility meets the criteria with the help of accreditation companies such as the Joint Commission, because their standards align with that of the federal government's. They therefore would be deemed and not have to comply with the Medicare, Medicaid surveys since they already meet the criteria. Essentially, if the facility already obtains accreditation, then they do not have to have the survey done. They have obtained a deemed status. CMS companies grant deemed status to healthcare organizations that have sought out accreditation from institutes like the Joint Commission, DNB, HFAP, etc. So basically, if you want to receive payment for Medicaid and Medicare, being accredited by one of these organizations is a huge help, and it prevents you from having to go through other processes and surveys through them. And then on the next slide, I just kind of made a list of major accreditors who have deeming status. And you can look at that. And then the next one is explain the process and frequency of Joint Commission surveys. Why would a hospital choose to be accredited by an organization other than the Joint Commission? So for the survey, at least every 3 years, the Joint Commission sends out an expert team of healthcare professionals to conduct an on-site hospital survey. This includes interviews with senior hospital leaders, doctors, and nurses. This is not scheduled, and facilities must be prepared at any time. Added to the process in 2004 is the tracer method, which involves tracking a patient's hospital stay and following the course of treatment from wherever it originates through every department of service that touches them anywhere in the organization. Following the survey, the Joint Commission issues a report that may list areas for improvement and ultimately includes an accreditation decision. Accreditation isn't automatically renewed, so hospitals must reapply and be evaluated again to remain accredited. And obviously, to be accredited, it's a voluntary thing, and you don't have to go through the Joint Commission. You can use somebody else. A reason maybe why you wouldn't go through the Joint Commission is perhaps you feel like their standards are too stringent, or maybe rather than doing every 3 years, you would want to do it every year, or maybe you just want to use a less expensive organization.